Good morning, good afternoon, good evening, everybody. We are just welcome to the August Global Digital Health Network monthly meeting. We'll just give everybody a few minutes to join. While we are waiting, if you would like to introduce yourself in the chat box, please feel free to say hello, tell us where you're calling in from, and we will start in just a few minutes. Okay, I think we have a quorum, so we can get started. Again, good morning, good afternoon, good evening to all of you who've joined. Welcome to the Global Digital Health Network August 2020 monthly meeting. I'm really excited for our topic today, and especially our really awesome panel of speakers that we have with us today. So today we're talking about Built to Last, the making of sustainable human resources for digital health. My name is Christina Villela. I am one of the co-chairs of the Global Digital Health Network, and I am joined by my colleagues here from several different organizations around the globe working in health informatics and deploying health information system solutions in country. So before I introduce our panelists, I would like to just give a few reminders about just take care of our Global Digital Health Network business. So just a reminder that if you receive this webinar invitation from a colleague or a friend, welcome. We're really excited that you're here today. We would love for you to join the network, so please do subscribe to our listserv. Our awesome fellow, Rohini Rajgopal, is going to post that in the chat, the link to be able to sign up for the listserv. Also a reminder that we are having our annual Global Digital Health Forum this December 7th through the 9th. It will be fully virtual event. We are really excited for this new page of the network's chapter here and going virtual this year. We've been looking into platforms and the opportunities to really make it a very engaging event that, to make it mimic it as much as we can the forum that we know and love, while also increasing participation for those who have had travel barriers in the future. So we are really excited for that. Registration has not opened yet, but it will be opening in the next month or so, so please stay tuned. We are also, thank you to everyone who did submit abstracts. Abstract submission is now closed. We are currently reviewing abstracts, and those acceptances will go out next month as well. So we are really excited. We have a lot of wonderful abstracts that we are pouring through right now to make sure we are able to create a really exciting event for everybody. So with that, I'm going to introduce our speakers for today. So while I'm going to introduce our first set of speakers from representing HELINA and several of the Health Informatics Associations on the African continent. So our first speaker is Dr. Tom Aluch. Dr. Tom Aluch is a health systems expert with an interest in the design, implementation, and evaluation of digital health solutions in low-income settings. He is also the current president of HELINA and chairman of the Kenya Health Informatics Association. Next, we will hear from Ms. Carol Kamasaka. Ms. Carol Kamasaka is a Ugandan national with 10 years of experience supporting senior leadership at national and subnational levels to access and use strategic data for decision-making. She is a digital health specialist with the Division of Health Information at the Ministry of Health in Uganda and is the president of the Uganda Health Informatics Association. Mr. Stephen Wenye Macharia is a digital health specialist with over 20 years experience at the front lines of implementing digital health solutions in low and middle income countries to support research for health and healthcare service delivery. He is also the founder and secretary general of the Kenya Health Informatics Association and secretary for HELINA. And last but certainly not least, we'll hear from Dr. Francis Baba da Costa Vroom. Dr. Francis Baba da Costa Vroom is a digital health specialist and lecturer with the School of Public Health, University of Ghana. She also serves on the executive committee of the Ghana Health Informatics Association and also on the HELINA board. And so after we hear from these four colleagues, I will introduce our next set of colleagues who will talk about the electronic health solutions. But without further ado, I am going to turn it over to my colleague, Dr. Tom Aluch.
Thanks. Good morning, good afternoon, good evening, everyone. Yeah, thanks so much to the Digital Network for giving us this opportunity to share with you our just our thoughts and some of our activities that we are performing at HELINA. So like you said, my name is Tom Aluch. I'm the current president of HELINA. And I'm just going to be sharing with you on this topic about sustainable human resources for digital health in Africa. So just quickly talking on HELINA, HELINA is the Pan-African Health Informatics Association and the African regional body of the EMIA, the International Medical Informatics Association. And HELINA was founded in 1993 in Nigeria under the auspices of EMIA, and is really like an umbrella body of national societies that with an interest in health informatics in African countries. And the primary purpose was to promote education and research in health informatics and implementation of ethical, modern evidence-based e-health projects to enhance access to quality care in Africa. I mean, yeah, Africa has been lagging behind, as you can tell, in digital technology, but through national societies, the aim is to do Africa-based research, promote Africa-based research and education, but in a way that aligns with with the global trends and international best practice. And HELINA fully subscribes to the EMEA's vision that there'll be a worldwide system approach to healthcare. And on this, I mean, through this, clinicians, researchers, and patients will be supported by digital health tools and processes to make appropriate decisions to improve healthcare for all. And the systems approach will incorporate and integrate research, clinical care, and public health. So yeah, that's where the systems approach focuses on. Kind of just being sure that we have a systems-wide approach in clinical care and public health as well. And so HELINA holds annual conferences, which are attended by usually between 150 and 200 participants. The last conference was held in Botswana in Gaborone in November last year, and it was pretty well attended. And one of the opportunities, besides the networking of scientists and just presentation of the research that's happening or scientific work that's happening around digital health in African continent, there's also opportunities for pre-conference workshops, which are often run by experts in priority topics on digital health. So last year's workshop in Gaborone in Botswana featured data science. There's also the application of drones in public health and scientific writing, especially targeting young researchers. Next, please. So HELINA's vision, as you'd expect, is about quality healthcare for all in Africa that's transformed through health informatics research, development, implementation, and education. Yeah, we know the big role that digital health is now playing in transforming delivery of healthcare, and is a disruptive technology, and we've seen some of the evidence generated from publications. And so we align the HELINA vision to exactly that, to be able to transform healthcare through health informatics. And our mission is to support national member associations or societies so that they can become collective voice of health informatics in Africa, providing a meaningful forum for health informatics research, development, implementation, education, standards development, technology adoption, and so on, and related stuff for the region. Next, please. So just sharing briefly on the HELINA structure, the governance structure. We have the HELINA board, which I belong to, I lead right now, with membership drawn from Stephen is executive secretary, Baba, who's going to talk later on, is the incoming, the president-elect. So, and then under the board, we have 3 working groups. One is the education working group, which focuses on building capacity through pre-service education and also applied training on health informatics. And so through this working group, we support or work with different countries. And then later on, I'll talk about some of the examples of some capacity building stuff that the education working group is working on. And then the second one is the standards and interoperability working group, which mainly supports countries or through national societies to establish standards and policies on health information exchange through open standards. And we know that this is an area that's new, relatively new, picking up, but we realize the importance, especially as we move across integration of disjointed systems and having to be able to meaningfully exchange data through open standards. So that's what the working group is focused on. And then the third one is on data analytics and big data, which focuses on artificial intelligence and machine learning and other tools for advanced data analytics and visualization, and also modeling to promote data use. Next, please. And so this slide here shows the HELINA membership, and we have 12 fully affiliated members to HELINA. And you can see that on the countries that are shown in green on the map of Africa. Those are the 12 full members. And then we also have collaborating countries. Those are the countries that are highlighted in blue on the map that mainly are collaborations through ministries of health and through universities. So again, we're trying to encourage more and more countries to form national societies so they can be affiliated, and then we can share all these experiences across the countries. Next, please. So just going through some of the recent and current capacity building activities that we are engaged in. So as I mentioned, I mean, the education working group, one of the things they've done lately is the harmonization of curriculum for master's training in health informatics in East Africa. And this was done through the Commission for Higher Education in the Eastern African region, which brought together 5 countries in the East African region to just harmonize their masters in health informatics. What we realized was that different countries, each kind of doing their own thing, the curriculum are not harmonized. Some of the countries claim to offer master's training on health informatics, but when you looked at the content of their training, it was really very shallow. It was often based on very outdated content. And so the thinking and the buy-in from the Commission for Higher Education in terms of like kind of just trying to harmonize this and come up with something that's standardized that cuts across universities and get that buy-in, I think was really helpful in just trying to improve the quality of graduates that come out of master's training programs. And then the Education Working Group is also working on developing online tools for capacity development and collaboration. Yeah, and there's a few examples. A lot of this is still work in progress. Then there's a program that CDC, US CDC does for kind of in-service type training. It's called GHIA. That's the Growing of E-Health Expertise and Knowledge. And it's mainly kind of like very hands-on type training, a combination of theoretical principles combined with real life projects. So it's done over a 6 months period. And last year we had the benefit of, sorry, excuse me, the GHIA trainees kind of presenting some of their work at the HELINA conference. And we're also hoping that in the upcoming conference in Uganda next year, that there'll be an opportunity for them to present. And then we do have the annual conference that I talked about earlier. So we are currently in the process of planning for HELINA 2021. That's going to be in Uganda. Next year, we're planning this jointly with the Uganda Health Informatics Association. And just to mention that the papers that are accepted for presentation at the HELINA conference are normally published in the Journal of Health Informatics in Africa. And the link for that journal is right there. And the other thing we're working on is kind of forging stronger community engagement through national societies, through working groups, and through partners. And actually, one of the things we're hoping to achieve in our participation in this webinar is to be able to create new partnerships, to reach out to new partners, and just with people with an interest in developing health informatics capacity in Africa, but also just some of the other areas that I talked about through our working groups. And we're also working towards establishing a secretariat based in Ghana. Next, please. So also just to mention that HELINA is collaborating with the Africa CDC, and our latest, some of our activities, last year, HELINA was involved as a member of the task force that developed the framework for public health workforce development by Africa CDC, 2020 through 2025. And two things that I want to flag from our engagement here. One of the things that we really felt was important is just describing those kind of strengthening the knowledge about health informatics through ministries of health, because as you know, Africa CDC is mandated, I mean, is an entity under the Africa Union. So it draws its mandate from the Africa Union. And has regular meetings of ministers of health in the respective African countries. And so through these documents, we're able to reach all the 51 member states of the Africa Union and be able to share these guidelines with them. And these guidelines include not just training and harmonization of training, but also mainstreaming positions and working around career paths and career opportunities for graduates of health informatics degrees. Because what we realize also is that health informatics is not formally recognized as a position within the ministries of health in many African countries. And so there was really never a clear career path for graduates of health informatics. So that's now captured in this framework and was a pretty important piece. And then we're actively seeking partnerships, both technical and funding, for future sustainable capacity development initiatives and research education and digital health implementation. Next. So our goals over the next 2 years, I'll run through this pretty quick, and this is my last slide. First of all is to strengthen the activities of the working group, which I just mentioned, through networks. And we're hoping that, again, we can reach and be able to get new membership and new networks from this webinar, and especially colleagues from academia who have a keen interest in research. Then also just get enhanced participation of national societies in their respective countries, digital health capacity development initiatives, both in terms of policy, influencing curriculum review, but also just been chiming in on e-health strategies development and so on. Then we run regular workshops and webinars, especially during this COVID season. We've had a series of webinars presented by some of our members, and these have been very well received and have been very great opportunities to share. And then just to enhance our visibility and also to increase participation in the HELINA conference to promote research and collaboration with universities. Yeah, next, please. And so with that, I'm going to just hand it off to our three presenters who are all members of the HELINA. That's the Ghana Health Informatics Association, Uganda Health Informatics Association, and Kenya Health Informatics Association, which is my home association. Thank you very much.
Okay, thank you very much, Tom, for the presentation. So I'm going to go on and talk about the Ghana Health Informatics Association. This is Baba, Francis Da Costa Room, and good afternoon, good day, good evening to everybody. So next slide, please. So the Ghana Health Informatics Association, just like all other health informatics associations, is a non-profit organization in Ghana. It sort of started around 2011, but became a bit more steadfast around 2013. All right, and we had the opportunity to host the HELINA conference in Accra in 2014. So it was set up primarily to give a strong voice for the practice of health informatics because health informatics training started in Ghana in 2006. And we realized that, as Tom alluded to earlier, that it wasn't well known. The industry was not well known. Even the Ghana Health Service and the Ministry of Health were a bit unsure of how to handle graduates from the program. So we thought it would be a good idea for graduates from this program and other experts in the field to get together to give a strong voice for the practice so that various initiatives could be undertaken. So our membership includes health informaticians, or people who are trained directly in health informatics programs at either the undergraduate or the graduate level. We also have doctors, we have health information officers, we have pharmacists, researchers, data scientists, nurses, entrepreneurs, students, who are all members of the association. Next slide, please. So our mission is basically to provide leadership, which we think is very important because we need that voice, we need a strong voice to make sure things are being done in the right way. So our mission is to provide leadership for health informatics community to support healthcare delivery using cutting-edge ICT solutions. And our vision is basically to improve healthcare delivery in Ghana. As we know, in most low middle income countries, healthcare delivery is still a little bit difficult. It's not very accessible, but we believe that with ICT, we'll be able to achieve that. And then not just in practice, but also make sure that there's a strong research background and there's evidence-based decision making for healthcare delivery. Next slide, please. So our strategic objectives were, first of all, to advocate for a scheme of service for HI professionals in the Ministry of Health and Ghana Health Service. And this was very important because, as I mentioned earlier, the health informatics profession, and I think Tom also mentioned, the health informatics profession is not well known and there aren't positions. And so even in a recent conversation with management at Ghana Health Service, the idea was, yes, they know those positions are needed, but due to financial resources, those positions are not being created. And so most often you have health information officers or health information managers occupying those positions. Or you also have people who have health information officers who have gone on to do health informatics at the graduate level, really just occupying their same old positions without their roles being changed or without any enhancement. So it's very, very important for us to look at the scheme of service. It's also, one of the objectives is also to provide a platform for the learning and professional development of our members. Also, again, very important to build linkages with other health professional and regulatory bodies. So the Ghana Medical Association, because we have a number of doctors who are part of our group. So if a doctor in a hospital wants to transition, or there's a need for a doctor to transition to a chief medical information officer role in a big hospital, there has to be some understanding by their regulatory bodies on how to deal with such positions. Again, same with the Nursing and Midwifery Council and the Pharmacy Council. So all these are very, very important. And the other concept is that apart from the regulatory bodies or the licensure bodies recognizing these rules, the health facilities through the regulatory bodies will also be encouraged to create those positions in health facilities. So building those linkages are very important to us. And then also advocating for the adoption of e-health at all the service delivery levels. And, you know, we could be going from the lowest level at in a village or what we call CHIPS compounds in Ghana. So these are community health-based planning systems where we have health officers living within a health facility, and they are the first point of call for most community members in the villages. So having healthcare delivery or having some sort of technology use at that level could also help improve service delivery all the way to the tertiary facilities. And then finally, to provide representation for our members on all relevant national bodies. Next slide, please. So our key activities include, as I indicated, building those linkages, so having presentations and meetings with groups such as the Ghana Medical Association. And this is, I mean, one of the key bodies in Ghana, very powerful medical association. And so when you have a link with them, you are able to go far. We've also looked at obtaining appropriate placement for undergraduate students who have undergone some health informatics training for national service. So in Ghana, after your graduate degree, every graduate is mandated to undertake a 1-year national service. And they are usually posted in different roles. They could be teachers, they could work anywhere based on some placement that's done by the authority, the National Service Authority. And so, but it's also a good ground for students to gain some work experience. And so we made attempts to have them placed in roles that will enable them gain health informatics work experience while they are serving their they are undergoing the national service, so that after the period, they would have, first of all, yes, gone through the national service and fulfilled that requirement, but also gained practical work experience, which will be useful when they start looking for job opportunities. And then also development of CPDs for other health professionals, because we recognize that, yes, not every doctor, nurse, pharmacist, or allied health professional would go through a formal health informatics program, but because they are going to be interacting with technology at various points of their care, of their work, it will be useful for them to have some level of education. And then also webinars, and workshops for members to keep up and then keep up with current practice. Next slide, please. So some lessons we've learned over the years, as I first mentioned, the fiscal space in government agencies, which is the biggest employer of HI professionals, is very limited. So if government is not hiring or they are not creating the positions, then people who undergo training go from school to their old job roles and do exactly what they've been doing before they went to school. And then finally, wait for some position, maybe in an NGO. So the fiscal space is very limited. We also have HI professionals who are also still in other roles as biostatisticians, health information officers. So their roles don't really change a whole lot when they go back. We also realize there's more public sensitization that is needed and more clear-cut job roles, because you still have the occasional person asking, so what do health informaticians do? Or you have, being a lecturer, I have students or people come in to the school inquiring about job opportunities after undergoing a health informatics graduate program. So these are some of the lessons we've learned over the years. Next slide, please. I think that's my last slide. So thank you very much. And that's what I have concerning GHIA. Next, over to my next presenter.
Thank you, Baba. Good morning, good evening, good afternoon, everyone. As earlier mentioned, my name is Kamasoko, President, Uganda Health Informatics Association. I'm here to present our journey as an association and our plans in building sustainable human resources for digital health. Next slide, please. About the association, it's a non-profit organization for health informatics professionals in Uganda. It's a young association founded by health informatics students from Makerere University and formally registered as an association and non-profit organization in March 2020. Our association brings together doctors, nurses, clinicians, health scientists, researchers, data scientists, etc. in the health informatics and digital health space together to share experiences, to forge a way forward around health informatics in our country, but also to provide a strong advocacy platform to discuss collective interest on the use of digital health in Uganda. We also work by engaging in activities that bring members to discuss e-health matters such as trainings and seminars, research, participation in digital health national policy formulation, which is actually currently going on in the country. We have a number of health informaticians that are not just working with the Ministry of Health, but other organizations and partners taking part in the policy formulation for digital health. Next slide, please. Our vision as an association is to grow and nurture collaborative health informatics community that encourages and supports the use of information technology innovations that contribute to improved healthcare, better quality, accessible, and sustainable. sustainability of health services and health outcomes in Uganda and its neighbors. And our mission is to bring together health informatics professionals in Uganda to advance health informatics science education and practice through mutual learning and exchange of knowledge, skills, and ideas. Next slide. Our objectives are advocacy, collaboration, membership, capacity strengthening. We are looking at health informatics capacity strengthening. And this is not just for the members, but also the health professionals and health workers in Uganda, and also promote academic and professional excellence through research. Our strategy is to build individual and institutional health informatics capacity in Uganda, work with the government and health development partners to support development, implementation of digital health policies, strategies, and standards for digital health, governance and stewardship in Uganda, and also support health research. I also need to mention that we are privileged to have the support of the Ministry of Health and the Makerere University School of Public Health, which is the main house for health informatics courses in Uganda. So we are collaborating with those two bodies to push our agenda as the association ahead and also build capacity of health informatics professionals. And next. Our key activities, being a young association, and also I must applaud the support we are receiving from other regional associations like the Kenya Health Informatics Association, but also HELINA. We are receiving a lot of support from HELINA as a Pan-African body for health informatics, and also proud to announce that we are going to be the hosts for the next HELINA Pan-African Scientific Conference. It was supposed to happen this year, but because of what's going on with the pandemic, it's been pushed to March 2021. We are looking at holding it in person, but should this pandemic go on, we might opt for a virtual conference. But we also hold monthly topical seminars for members to share knowledge. We have been focusing largely on digital health that are being used for the pandemic, but we have since then opened it up to the scientific areas that we are going to be discussing at the HELINA conference in March. We also publish a quarterly newsletter with topical issues and for knowledge sharing. In this newsletter, we also publish health informatics journeys for individuals. We also share papers and articles from several digital tools that are being used in Uganda. We're also conducting focus short IT courses for health workers across Uganda to improve their IT knowledge and skills through a program which we call Building Health Informatics Capacity for Uganda. This is in collaboration with a CDC-supported partner called Monitoring and Evaluation Technical Support Program. We are partnering with them to conduct those short IT courses for our health workers at health facility level, because we are looking at going digital as a country, and we realize these health workers will need the basic IT skills. So we have built that program basically for our health workers. We're also partnering with institutions of higher learning to promote health informatics focused research. We're also building a collaboration innovations hub to produce relevant digital software applications for use in the health sector. We are looking at locally developed solutions instead of going out and getting solutions from out of the country, yet we have the capacity in the country. Next slide, please. So our call to the global health community is to ready themselves to, one, attend the HELINA Pan-African Conference in March, whether it's held virtually or whether it's held physically in Uganda, but also to call the global health community to collaborate and engage with our members on e-health related research. To also partner with the association as the first point of contact for digital health labor to advance jobs as well as volunteer opportunities to our members for tested knowledge and trusted skills. Maybe in regard to this, we are also trying to engage the ministry having to have or create a structure that allows in health informatics professionals and not just ICT professionals to come and do the digital health work. We have the leverage of myself working with the Ministry of Health and other members of the association. So it's one of the agendas we are trying to push for the ministry to consider. And I must say we are receiving a lot of support from senior and top management in terms of health informatics capacity in the health sector. We're also calling to partner with associations to build an innovative hub, software testing center to produce relevant software tools and skills locally in the country. Next slide, please. So if you want to join the association, that is our website. You can also reach us on that email. Thank you very much.
Hi everyone. So my name is Stephen Onye, and I'm going to present on behalf of the Kenya Health Informatics Association, in short, KeHIA. Next slide. So KeHIA is a professional association, society that was legally registered by the government of Kenya about 8 years ago, going to 10 now. And basically the primary goal of KeHIA is to promote, the development and practice of biomedical informatics in Kenya. Now, we specifically still use the term biomedical just because a lot of our members are still involved in basic science research, and they're applying digital health or technology, ICT, in their scientific work. And so they form a big part of our membership. And that's why we still use that term a lot for this association and sort of to refer to the kind of work we do. We have more than 250 members, and they're drawn from different backgrounds, from health sciences, information sciences, computer science, public health, and also bioethics and law as well. And we've got increasingly a lot of members joining from policy and governance, both from the public and the private health sector in Kenya. Next slide. So these are the gentlemen who lead KeHIA. Unfortunately, we don't have a lady, but we're hoping that as we get closer to the end of our term, that we'll actually get we'll get better gender representation. But basically, HELINA was KeHIA was born out of our attendance of the MedInfo. The MedInfo is the Medical Informatics Conference that is hosted by the International Medical Informatics Association. It used to be held every 3 years, but now it's every other year. And in 2010, a couple of us attended that meeting in Cape Town in South Africa that was hosted by the South African Health Informatics Association, KeHIA, who are also members of HELINA. And that's how we got inspired to start KeHIA. So the gentlemen you see here are all co-founders of KeHIA. Tom presented earlier. He's now working in CDC Atlanta. And then Dr. Davis Kimanga works for CDC Kenya. Dr. Martin Usumba works for RTA International. And Dr. Ngure Nyaga works for Savannah Informatics. So all of them are medical doctors with a very strong interest in informatics. Tom and I have similar backgrounds of technology, and we've ventured into health and using our technology backgrounds to try and improve healthcare outcomes. Next slide. So basically, some of the key achievements that KeHIA has contributed to, on the left where you see a couple of images, is we've been key contributors to these very important documents that are basically foundational for digital health practice in Kenya. And these are Ministry of Health documents. So we contributed significantly to development of the first ever e-health policy that runs until 2030. We also contributed to development of the standards and guidelines for interoperability, for mHealth systems, for EMR systems, and there's a bunch of others as well that are not listed here. And all these are what are used by the ministry now to govern digital health, adoption, implementation, and use in Kenya. And we've also been contributing, we've actually been contributing recently to development of the e-health bill, but prior to that in the legislation sort of domain of things, we also contributed to development of the Health Act in Kenya 2017, which has a really big section on e-health. So KeHIA made official contributions to that. We've also hosted a couple of international digital health conferences and workshops, most notably in our close partnerships with OpenMRS, but also, and we've done that twice, in 2013 and 2018. And we did that back to back with HELINA. So we had Open MRS first and HELINA second, back to back in the same week. And those were really well attended, very instrumental in terms of influencing how things have played out in the public health sector in Kenya. We also hosted a validation workshop for development of the measure-led interoperability maturity toolkit. Glad that I worked closely with Christina, who's here, Sam, and others who are working very closely on that initiative. KeHIA has also hosted several times and convened, I would say, what is perceived as neutral conferences or neutral forums to discuss especially very sensitive issues. As you know, the issues that become very sensitive, and it matters a lot who convenes and who hosts the discussions or the activities. And we've been able to host those and navigate the discussions fairly well and gotten very good outcomes that have gone ahead to be used as inputs by Ministry of Health into critical documents. We've also continued to contribute to critical input into informatics pre-service and also pre-service curriculum, working very closely with the universities and other academic institutions in Kenya. Next slide. So there are a couple of opportunities that we're inviting the audience here to reach out to KeHIA and participate in. So as I mentioned, we work very closely with the Ministry of Health, serving in the technical working groups. And I put that image there deliberately just to show that the Ministry, of course, keeps changing the working groups because these are functional constructs, but they generally are well aligned with the foundational components of digital health or e-health, and those are well described in the WHO e-health toolkit. These are some of the areas that we feel we are providing a lot of contribution and influence in Kenya in terms of digital health advancement. And this will be some areas that we'll be more than happy to partner with anyone in the audience who will be interested. We've also been working on establishing the Kenya Health, the KeHIA Informatics Journal, KIJ. And we had started doing this aggressively, but we decided to slow down and start off with a newsletter, and that has picked up quite well. We've been issuing out quarterly newsletters and monthly as well. And so we want to ride on that success and then launch the Informatics Journal. So anybody who's interested in that, please reach out to us. Our editor-in-chief is actually a Kenyan who lives in Utah. He's a director of biomedical informatics called Chris Olola at the International Academies of Emergency Dispatch. So we'll be more than happy to put you in touch with him. We're putting together the team. Again, as I mentioned, we also convene frequently important discussions around digital health. So if you'd like to partner with us, we're happy to co-convene and co-host. We're also working on improving the professional competency of practicing informaticians. So working with a lot of people who have a lot more expertise and experience in this area. So again, we'll be more than happy to partner with you. And we're also always available to provide really professional, objective opinions about the digital health landscape in Kenya. Next slide. And yeah, if you want to reach out to us, that's the best address to use, secretary@kehia.org. But if you also have my personal address, Stephen Wanye, we'll also share that as well. Please reach out and yeah, let's collaborate and improve use of health informatics in Kenya and in Africa broadly. Thank you.
Great. Thank you so much, Stephen, Baba, Tom, and Carol for taking the time to be here with us today and talk about and share the work the really important work that you're doing as the many of the informatics associations in your respective countries, and then of course HELINA being the convening body across the African continent. I think I really do hear those calls to partnership and to work with the Informatics Association, and I hope those on the call also hear those calls. I think it's really important for furthering the work in digital health and making this work sustainable for the long haul. So we're going to kind of switch gears just a little bit. We're still talking about building sustainable human resource capacity, but somewhat of a different model. I have two colleagues from Jordan here with us today. First being Mr. Faraz Kamal. Mr. Faraz Kamal is the Chief Executive Officer for Electronic Health Solutions, which is a private nonprofit company in Jordan that is responsible for automating the public health sector on a national level through the Hakim program. And secondly, we also have with us Mr. Joseph Dalmalen, who is the co-founder and chairman of World Vista, a nonprofit that works to improve and facilitate international adoption of the acclaimed Vista EHR. Joseph also helped to develop and supervise a software implementation and sustainability strategy for Jordan's groundbreaking national e-health infrastructure. So I'm really excited to have our speakers here with us today. I believe Mr. Faraz Kamal is going to present, and Joseph will be here for questions in the Q&A time. But I'm really excited for us to hear about this a new model for kind of building and sustaining capacity and being able to roll out an EHR at a national level. So I'm going to change slides really quickly and pass it over to Joseph, or sorry, to Faraz.
Thank you, Christine.
All right, you should be able to see.
All right.
Yeah.
Thank you. I hope everybody is fine, and then thank you for HELINA. Thank you, Christina, for giving us the time to present in HELINA and to talk about our experience here in Jordan in establishing a national e-health or national EHR implementation across the board. So basically, I mean, for the sake of time, I might be running fast, but anyway, we could chat at any time later if anybody would like, more elaboration. Next slide, please. Electronic Health Solution, EHS, is a non-profit company that, aim to transform and sustain a continuously improving health system in Jordan by leveraging technology. It was created back in 2009, and His Majesty King Abdullah II did attend the inauguration of this company. Our owners, actually, they are the Ministry of Health, the Ministry of Digital Economy and Entrepreneurship, the Royal Medical Services, Private Hospital Association. This is a non-for-profit association, along with King Hussein Cancer Foundation and the Royal Health Awareness Society and the King Abdullah II Fund and Development. Next slide, please. So basically in EHS, we have 4 programs since the start. We started with Hakim program, which is, started back in 2009 with the aim to automate the public health sector in Jordan by implementing electronic health record, EHR, and we used Vista EHR as the base for our implementation. Vista, for those who doesn't know, it's an open source technology. We leveraged very important thing, which is the national ID number, to be our unique identifier in order to establish one record per patient across the board. In 2013, we have looked into something very important, that we need to elevate the knowledge of our physicians and medical staff by offering, evidence-based medical resources. And this is where we created the Electronic Library of Medicine in Jordan. We called it ILM. And in 2015, again, we looked into our very important strategic thing, which is looking after the university and see how we could team up with them by signing, MOUs, and we'll talk about them later. The whole issue is to get them more in touch with the latest in terms of, informatics, because it is very important to have the new graduates ready for the market once they graduate. By the time of 2019, we felt it's important for us to issue the 4th initiative, which is HUDA, and this is the health data analytics, and it deals with the data since we start having a big data. By the way, those 4 initiatives do require massive and diversified of qualification in order to push those programs forward. Next slide, please. EHS in numbers, and I'll touch base on some of the important numbers. We have currently 7.1 million records in our databases of Hakim. We have managed to do 196 sites. We have finished around 77% of the current public health sector automated beds. We have done and trained 34,000 end users to trained on Hakim. We have our which is very important one, the mobile application for our doctors. When it comes to ILM, we managed to have registered 23,000 end users. We have also, when it comes to the Hakim Academy, we trained about 3,000 students on the Hakim platform. And when it comes to HUDA, which is the health data analytics, we are, as I said, recently started. So we managed to have some sort of a periodic reports for our institutions. Additionally, we have engaged in several studies, to support researchers and decision makers. Next slide, please. So EHS, in order to fulfill the enrollment, definitely we have a diversified, key or skill sets that's available. And the good thing about it that EHS do have basically the clinical, the clinicians in one hand, as well as the implementation or the technology on the second hand in one company. And that would allow us, to go freely in supporting our implementation. In addition, this again, it requires building capacity because as you have seen, we're ranging from health analytics to software development to PMO office to some sort of, the business continuous services, etc. Next slide, please. So even, we in Jordan, we have looked into the women empowerment and we felt, it is very important to get them engaged with our program. So currently in EHS, we have around 30% of our employees, they are female, and the good thing about it, they even range from managers to team leaders to seniors. So they're taking different positions. When it comes to youth, we have around 75% of our total employees, which is 310 currently, they are, between the age of 22 to 35. Next slide, please. EHS roadmap, and this is very important, a roadmap for us wasn't an easy. I mean, we started back in 2009, and at that time, we were thinking what to do, and it was very important to take an important role in selecting the software that we will use, and we landed on the open source technology. And again, landing on an open source technology does require, a massive commitment from and consistent actually commitment as well over the years in order to keep, train and retrain employees and expand as you go forward. So we started with 20 employees, and those 20 employees, we actually started, to teach them with contracting some international company to make some sort of a knowledge transfer, and then we decide to build the capacity and to put a plan for rollout, and then we roll out between the time of 2015 and 2017. Then we started opening up more toward adding more into our EHR, which is the patient billing, along with the establishing the health informatics and business intelligence, and that's very important for us because we believe data is essential, and we're about to add more into the interoperability and look for the patient empowerment as well. Next slide, please. So as I said, today we have 196 sites, And you could see, we started to be slow at the beginning, and that's, known because we have to have the knowledge transfer needed and to build capacity. And then we accelerate, and then, we start looking into what we call it more than just a general hospital, complex hospital, or what we call it a center, a bigger center, where it become, like in the range of 1,000 bed and more. So that, it took us to concentrate more into scalability, where we can scale up the company to become capable of handling more projects and sophisticated projects. Next slide, please. So people might think, when we do and when we say we're implementing HAKIM program and concentrating on VISTA EHR, it's a simple matter. Implementation is really difficult to do if it's not done and planned correctly. You can see, VISTA, it has many modules. It has 168 modules, and I'm showing some of them, the core, where it's definitely needed. We have to train people and to build capacity within our team, along with the end user side, in order to be able to implement a solution like, VISTA all the way across Jordan. So we're responsible into installation of hardware, network, again, the VISTA implementation side, along with the clinical transformation activities and documentation, interfacing with certain medical devices, full training and support for the facility staff, and we stay and support the full go live along with the business continuity afterwards. Next slide. So as we said, it is very important to consider the knowledge transfer, and we start. That was our aim from the beginning. We in Jordan, we are a country that has a limited resources, especially financial resources. We're good in manpowers, and in order to achieve this goal, which is the self-sustained, we thought that it is very important to start, considering the knowledge transfer from day one. Even, at a point, and Joseph here with me, we thought of changing our initial contract to become, instead of piloting the first site, into saying it's a building capacity program. And literally, I'm one of the founders to the company and to the program, and I still remember the early days till now. We would have not been able to sustain today if we didn't go and choose the right software where we could, sustain and build the knowledge within the company, given the current, economical situation that Jordan is facing, like any other countries. So basically, we concentrate on conducting online and offline classes. We looked into consultants, bringing them on short-term experts. We all, again, meant to focus into mentoring during the implementation, because that's a key success when it comes to implementing an EHR. Also, we collaborate with different organizations like WordVista, Registry, and Snowman. So basically, we end up creating what we call it a proper documentation approach, methodology, repository, all of it based on standardization that needed from our end. Additionally, we had really to look into succeeding on the implementation. If we would have not done it the way that I said it earlier, in terms of documentation and standardization, probably we would have not succeed in implementing a countrywide implementation. We would like, to maintain one system all the way across hospitals, primary clinic, comprehensive clinic, with all the support that needed for business continuity. Next slide, please. So one of the examples that I always pick and choose, which is the clinical transformation part, and this is very important, where our team needs to learn it at the early stage and learn the process, how we do it, and learn it, and then to the end users, where eventually become the owner of the solution with us, and they accept all the changes that needs to happen, again in collaboration with us, being, seeing the future state, and what it takes. So basically we do the current state, we teach them the future state, then we address the gap, and we put a plan for the change. And this is, again, it's an important role. Without it, you would really be astonished to know that you will never be able to succeed in a nation implementation, because you're merging technology, you're pushing the technology with the human resources along with the processes in order to optimize the change that needed to happen once you implement an EHR system. Next slide. It is, as I said, once we reach the 7 million, or the 7 million, about the 7 million patient records, we start thinking, we have the big data now. And our governments, the Ministry of Health, the Royal Medical Services, the military side, where they're responsible for the military personnel, I mean, they ask, now we need to analyze the data. Well, are you ready for that? And this is very important stuff. I looked at it, back in about a year. I said, we barely had a data scientist in Jordan at that time, who's really ready to engage on a health, or on a healthcare programs. So we had really to think, what to do, and we moved some of our employees rapidly, and we trained them aggressively, engaging other consultants to help us in doing so, bringing some people and some folks from the academia, to help. And we managed, to move on this matter. One important thing that distinct EHS, from any other company, that we are responsible for the implementation, as well as we're the custodial agent for the data in front of the government. So we could easily, look on the quality of the services and how it's been delivered at the front line. And if we feel the data, once we extract it, is not really up to where we feel, then we initiate what we call it a quality program in order to improve those fields need to be rectified and changed, or to improve the quality of the entry from the end user perspective. So we manage also to work on business intelligence solutions. Again, we will not be able to buy or hold on premise what we call it a solution that's ready from many international vendors. It's a very costly that Jordan cannot. So we have to look into open source and to develop some of our own tools, along with engaging it with the some of the commercial product that needed in a way or another. So yes, we are involved with lots of the projects, those projects, data projects that's needed for the country across by extracting data for the last 10 years to help the decision makers and the researchers in their studies and their evaluation. Next slide, please. This is an overview, slide that I always tell my employees here in EHS that they need to keep this image and think about the interoperability, about the diversity and the complexity of our system, systems once you put it in place, between implementing the EHR, between looking at the patient empowerment, which is my Hakim, and it's going to be hopefully launched toward this end of this year. In addition, we're also engaging the private with Hakim claim, where the insurance companies are encouraging us to go into that area. So we're at final stage on this, where we will implement also Hakim Light version into that. And we integrate the military and the civil insurance departments to make it easy to access the data regarding the eligibility of the patients. In addition, as I said, we went into the patient billing system and stock control because the Ministry of Health always, he speaks very highly of Hakim. However, when you talk to the Minister of Finance in Jordan, he say, what saving you have made, you have to show us. And unfortunately, before Hakim, it wasn't really an automated process when we talk about the billing. So right now it's integrated. We started with the pilot projects and we're rolling the country, with one system. I always say it is very important to have one system for a country, that's relatively small like Jordan. And then maybe, try always to think, and avoid the interoperability as much as you can because it's really hectic to integrate systems. Next slide, please. So again, we touched based on Hakim Academy and Ilm, and I'll, for the benefit of time, I definitely would skip into the next slide, please. So for Hakim Academy and the area of collaboration with the universities, we collaborate on the topic of integrating with an existing curriculum in the university. We establish Hakim Lab for them, for their graduates, or for the School of Medicine, School of Nursing, and School of Pharmacists, so they can practice on Hakim and be ready once they finish, their universities, to be ready for, if they decide to work on the government. Also, currently, we are trying to get involved in establishing Hakim Informatics program, that support those universities that we're signing with. We're sitting together and trying to figure out the best way how to do it. Again, we have our own competition that we try to encourage the students in the universities to come and do, some sort of projects. And usually we find it very welcome, and their engagement was really appreciated. Also, lately we put an online platform for Hakim Academy, and this to host all the materials needed and to support the university. Next slide. And to show our success, we managed to do an innovative projects, and you could see this would have not been done if we would have not been able to do enough capacity building programs and educate and train and retrain our employees in EHS. So next slide. And finally, which is very important, this is how we look at EHS and how did it impact the Jordanian economy. And as you see, the two important role, which is very important, the building capacity is very important to us, and innovation and giving back to the community. Right now, we're active members on the Vesta community, where we give back some of what we have developed in EHS to serve the solution. Next slide. Thank you. Thank you very much. And I'm sorry if I was running fast, but trying to help, for the benefit of time.
Great. Thank you so much, Faraz. This is very, it's very impressive, the work that you all have done, and to see this model of being able to implement electronic, health information systems at national scale, and kind of the work that goes and time and staffing that goes into that. So we are now going to move into the Q&A portion of our session. So if you have questions for our panelists, please do type them into the question and answer box, and we will make every effort to get those answered. So to kick us off, we do have, I know some people did submit questions in advance, so we did want to also make sure that we address some of those. So I think the first question that we have for our panelists, and maybe not all of you, maybe a few of you could answer this one, but what would be 2 or 3 key things to focus on to initiate transition to sustainability of human resources, or of electronic health information systems? Like, what do you see as the 2 or 3 most important factors for success? Maybe we can get 1 or 2 of our panelists to answer that one. Would anybody like to take that?
I could give that a shot. So this is Steven from Kenya. I think the one thing, of course, is that it has to be demand driven. I mean, I think we all know that the uptake of digital health obviously is increasing rapidly, but I don't think the market in terms of the industry is also adapting as fast. And I think that's because of a couple of reasons. One of them is we all know, for example, in most of our public service or the public sector, the sort of human resource scheme or the structure is still very old, in my opinion. And so, for instance, you find, in a very simplistic example, you don't have cadres of staff who are really trained for digital health. There is, I think, in my opinion, in many countries, especially in Africa, trying to convert folks who are trained for health records management into digital health, which is great. I mean, there has to be a transition. But I think beyond that, the policy, the law and all, has to deliberately, I think, in my opinion, update or change the service scheme so that it actually recognizes the health workforce that is required for digital health. Carol and Baba, you want to provide another one?
Thank you, Steve. Okay, I'll just add that in terms of training, if we're going to keep things sustainable, we have to try and ensure that our curriculum is reviewed as often as necessary so that we stay up to date with the current trends. There are some foundational things that need to be covered in health informatics, but you also want the graduates to be able to fit in at any point in time. And so I think the training institutions will also have to work quickly, but that also ties into how quickly universities allow for reviews. Some of the systems are quite bureaucratic, but if we're able to work on all that, we'll be able to have good programs that students will be willing to sign up for, and that will also provide the quality that the industry requires. Thanks.
Great. Thank you. Thank you both. So the next question, I think I will direct this one to Faraz and Joseph, is how can you all obviously have come up with or have been able to obtain, you know, some level of sustainable funding to make EHS feasible and you know, to continue running as long as it has. Can you talk a little bit about how you were able to, and give any recommendations for other countries or ministries that may be interested in developing the model that you have, on how you were able to garner that funding and make the case for long-term financial sustainability for EHS?
So basically, I mean, I need really to emphasize that EHS, again, it's a not-for-profit, and it's mainly, you know, funded by the government of Georgia. So the fund, you know, comes from the government, and that depends on the number of projects we do it yearly. Okay, we put a plan on a yearly basis, how many sites we want to do, where they located based on strategy and planning between us and the Ministry of Health, as well as the Royal Medical Services. And then we come up with the, what we call it, the costing of those projects, and it's funded by the government. So the way that it is, I encourage people to look at it in a way that we looked at it when we established EHS, which is, again, if you bring a commercial company and you start, you know, putting it, all of it in the hands, you know, talking about electronic health records, this time, I mean, it's not easy to put it in control of a commercial company. So the way that EHS has been, you know, formulated, it supports this idea. So whenever you go to any institution and you talk to them, they look at you that you're really their partners. You know, they owe you in a way or another. So that encourage them, you know, to be open up if they have any network or anything that can be made or can be utilized, then we utilize what is existed and we add on top of it. If they have sufficient number of PCs, we utilize them. If they don't, then we purchase on their behalf. So basically, the model is totally dependent on the government. But at the moment, I mean, because of what we learned over the years, we did open, or we have a subsidiary, and this sister company is totally owned by the non-for-profit, but the difference is for-profit. And the intention is to try to go outside Jordan and to try to implement, you know, what we have learned over the years, you know, and helping other countries, but this will be, you know, for-profit. So the intention is, in a way or another, that this for-profit will be able to support the non-for-profit going forward. Because, you know, depending on one source of the income is really tough, especially when the economy of the whole country is facing some challenges.
Great, thank you. So we have some more questions coming in. This question is for the Health Informatics Association's colleagues. We have a attendee who wants to know, are the national associations self-funded, or are they funded by the government or another source of funding?
Okay, I'll answer that. They are not funded by government. They are self-funded, and we also raise funding from various institutions. So every activity, we will usually have to find some funding for it. Thanks.
Yeah, the other source of funding is usually membership. So like, for example, in Kenya, we have tiered membership fees for corporates, for professionals, and for students. You know, but that, as Baba has mentioned, that forms a very small percent of the revenue. And so most of the time, you know, we depend on like registrations for big events. So for instance, in Kenya, when we have hosted Open MRS and HELINA as KeHIA, we're able to make some money to support our secretariat through the registrations to the conferences. But the other increasingly opportunity that most associations are going after is just the typical grants, you know, that are available through the notice for funding opportunities.
Great, thank you. So we have another question. This one is for Baba. From your experience, what strategies would you recommend for countries to adopt to improve public health sensitization of health informatics?
Okay, that's a good one. What strategies would we recommend? One of the things, being at the School of Public Health in Ghana, one of the things that we are looking at doing in terms of getting more people interested in is to sensitize those in the undergraduate programs, like those in computer science, and then in the other health professional training programs, because they will usually form the core of people who would go into health informatics at some point. And so that recognition gets people interested in wanting to know more about what health informatics is all about. Apart from that, again, visibility by the association is also something that is critical, because when you have the associations organizing programs, organizing training on campus, for example, that's one of the things that we tried to do some time ago, was to organize GHIS training for undergraduate students at one of the private universities. And things like that will definitely get people to recognize the association and then generally health informatics as a profession. So it becomes an option for them. Thank you.
Thank you. So I see we have one additional question here that I'm going to ask our panelists to actually answer in the chat, but it's which universities in East Africa offer health informatics programs? So maybe if you could post those answers in the chat, that would be wonderful. So another question that we received in advance of the webinar was and this is for any of our panelists, what are some strategies to recruit and retain health informatics talent? And on the similar vein, what should we not do to try and build this local talent? So what are some strategies to recruit and retain? And then what are things that have not worked? Maybe two of our panelists could take that one.
Christina, thank you very much. Maybe on the strategies, from my very personal experience, I think if we engage the senior managers and top managers of ministries of health, it will be the biggest strategy for having the health informatics being recognized and being embedded into the whole structure of health, and not just health, but public service. Because right now, for example, in Uganda, it's just been introduced, so it's still a new field. When you talk about ICT or working with Ministry of Health and you're doing ICT, people might think you're doing health informatics, or a records assistant in a health facility might be looked at as doing health informatics. But it all goes back to us as the health informatics professionals and the associations to engage the senior leaderships of our ministries of health to start discussions on recognizing and embedding health informatics profession in the sector. Thank you.
And this is Stephen. I agree with what Carol has mentioned. The truth is that I think in most of our countries, the public health sector is the largest employer. And so structural, changes in the public health sector with regards to the human resource for health and specifically for digital health is really important, I think, in my opinion, to accelerate and ensure that what you're talking about can actually become practical. So I agree with Carol. And for example, in Kenya, I know that I started, and there's a huge momentum on that with, for example, passing of the Health Act 2017, which has now made e-health. The language in the law is that e-health is now recognized as a mode of service delivery, and what we are seeing and predicting coming after that is that now the government, working with the different stakeholders, will start describing what are the standards and the requirements in terms of then that mode of service delivery working as expected. One of that I'm hoping that will include the requirement to have qualified staff. And so we see these sort of structural changes then triggering that sort of demand that is required, that then downstream will require that people are trained properly and they come through the pipeline, right from pre-service into in-service.
Great, thank you. I'm going to see if Faraz or Joseph has any last words on that question about how to recruit and retain talent before we wrap up the webinar.
It's Joseph here. Yeah, if I could just chime in, I think the answer is painfully simple. I mean, one of the things you need to do is look at digital health strategy holistically. Now, there's a lot of countries doing roadmaps at an architecture level, et cetera. But you've got to think of the human dimension, sustainability in that context so that you create jobs. I mean, that's a simple answer. There has to be interesting jobs. As Faraz pointed out, EHS started with about 20 people. They have 360 or over 300 staff now. And that's rippled through the economy in other ways. So I think the biggest advice I'd say is think holistically and harmonize your strategies, your technical strategies, your capacity building strategy. Over.
Great. Thank you so much, Joseph. Okay, I'm loving this conversation, but I am going to wrap it up in respect for everybody's time, especially our panelists. I want to take a moment just to thank you all again for making time out of your very busy schedules, especially in light of the COVID pandemic happening right now, to be with us today and share your experiences and your lessons learned and your expertise with us. I think I could say I really enjoyed this session and have taken a lot of notes for things that I want to take forward, and I have lots of questions still, but I think it's just, you highlighted a lot of really important conversations and topics as far as how can we really be looking towards building sustainable human resources. I think that's a gap that we consistently keep hearing about in the global digital health space, is a lack of human resource capacity and high turnover. And I think looking at the Health Informatics Associations and the work you're doing to harmonize curricula and build out the the schema within the public health sector are wonderful examples of how we can really build in sustainability. And the EHS model is also really, really inspiring way to kind of also continue to build out sustainable models and resources for running a national electronic health record. So I just want to thank you all for being here. Thank you all to our attendees who stuck it out for the whole hour and a half. And we will be sending out a recording of this webinar and the slides. So thank you again and have a great rest of your day.
Thank you.
Bye-bye.
Bye-bye.
Thank you. Bye-bye.
Thank you.